why is this a good time to be talking about 3 myths of healthcare reform?
Well, Bob, I mean, you're absolutely right. We haven't been talking about healthcare reform very much, but I would dare to make the prediction that we're going to be talking about it a lot more within a year or two. We've been in the middle of running this enormous modern monetary theory experiment. It isn't called that in name, but in effect, that's what it is with the federal budget. Okay, with interest rates so low, we've been able to borrow hand over fist without any thought to long-term budget constraint, because borrowing costs, it's essentially free money. Well, that's coming to an end now. With inflation rising, the Fed's going to have to raise rates. That's likely to hit the markets first, but it will, with a lag, hit the budget and the fiscal policy debate, because soaring debt service costs all of a sudden will force Congress to grapple willy-nilly with the long-term deficit. And as it does that, all roads lead to healthcare reform, or specifically the subject of this issue brief, reform of federal health benefit programs. And that's because, other than interest on the debt, that's where the money is. That's what's driving the long-term budget projections. Spending on Medicare and Medicaid, this is net spending, net of premiums, is due to increase by 4.1% of GDP between now and 2050, according to the latest CBO projections. Social Security will increase by 1.5%. All other spending will decrease, actually, as a share of GDP. So we just thought that, given the looming fiscal crunch, it might be an opportune time to revisit some of the myths which have bedeviled and derailed the healthcare policy debate and prevented us from getting a handle on federal health benefit spending in the past. And I could briefly tick those off, or I don't know if
well, why don't you set up the just very briefly what the 3 myths were that we focused on, and then we can get into some of the meat behind those arguments behind those.
Sure. Well, the first is that you can control healthcare spending, and federal health benefit spending in particular, without anybody having to give anything up. Well, except maybe the pharmaceutical companies. Nobody loves that. But you can control the growth in spending without anybody having to give anything up, simply by eliminating waste and inefficiency. We can, in effect, have more for less. Right?
That sounds like a frequent federal budget claim.
That's made in other areas besides healthcare, but I think healthcare is kind of the granddaddy of for that one. The second related myth is that, well, if you don't believe this is true, just look at other developed countries, particularly countries with national health systems. They spend a lot less than we do, a lot less as a share of GDP. In fact, 50%, the next runners up, Switzerland and Norway, I think, spend 50% per capita less than we do. And yet they have better health outcomes, right? QED, slam dunk. The third myth is that you can't fix the federal cost problems, kind of a bait and switch, right? Unless you have comprehensive national healthcare reform that controls costs in both the private sector and the public sector,
which kind of prevents you from doing anything, because like you can't fix anything unless you can fix everything.
Yeah, healthcare is going to eat the budget, but you can't do anything about that until you fix an even bigger problem, right? Now, each of these myths starts with a perfectly valid premise. the US healthcare system is swimming in waste and inefficiency, right? It's massively subsidized by the federal government through direct spending, through the tax subsidy for employer healthcare. You've got all these cost plus incentives, third-party payment systems. It's both feet on the accelerator, and this generates a huge amount of waste and inefficiency. Okay. Second myth, other developed countries really do spend a lot less than we do and have much better health outcomes by various basic measures like life expectancy at birth. And yeah, it might be easier to control federal health benefit spending it might be as part of a comprehensive public-private solution. But then starting from these basic premises, the myths leap to totally unfounded conclusions. Yeah, there's a lot of waste in the system, but controlling costs will require real trade-offs for reasons we can discuss. Yes, other countries spend less than we do, but they spend less because they impose limits. Okay.
Yeah.
And yes, it might be easier to control costs as part of a comprehensive solution. Then again, it might be harder. Look at Congress's record over the past few decades in controlling existing health benefit programs. In any case, the federal government has plenty of tools available, both through reform of direct spending and tax and regulatory policy, to effectively and efficiently control federal health benefit spending without resorting to comprehensive healthcare reform.